So I'm Judith Gent Jones, Service Manager for Lancashire Foundation Trust, and I work in the Community and Wellbeing Network based in Southport and Formby Community Services. I've worked in the Southport and Formby locality for a number of years now, around 5 years, and over that time I've attended the locality meetings and the champions meetings before, and it's been really useful to have that dialogue and those interactive conversations, to hear feedback in the formal reports and face to face, and have that dialogue and really try and get to the bottom of some of the queries and understand the patient's perspective further. In response to some of the more formal reports, we've looked into issues in a little bit more depth, and recently it's helped us to steer our new service model and service specification, and it's prompted some work collaboratively across Sefton with our Mersey colleagues. So it's been a really useful piece of work, and it's something around podiatry services that I know the CCGs are looking to explore wider with their partners in other CCGs as a model moving forward. So it's been really useful. And it's nice to come back today and provide some update in terms of all the work that's been going on behind the scenes. And I'm Service Manager for Community Nurse and Treatment Rooms Podiatry and the Community Pain Service. And obviously when we get our Healthwatch reports, it impacts on a lot of different services using particular health centres, so often the feedback is multi-purpose. We can share it right across, and it's not just within a unified profession or service, and I think that's really helpful too.
Yeah. Lovely. Alright, so my name is Judith Spallen. I work for South Sefton Clinical Commissioning Group, but in regard to this work here today around podiatry, I've been leading also for Southport and Formby Clinical Commissioning Group. My job entails both urgent care services and also looking at community services across the South Sefton patch. So in regard to podiatry, which is what we've been examining today, it's been a really important area for us to engage with our local community. At the end of the day, the principles that we've used in terms of working with Healthwatch are ones that we want to use across all of our services. So just to start with, it's around actually getting that local voice and understanding what our local population needs, and then making sure that we develop those services so that we can meet those needs. Working with Healthwatch, what we've been able to do is actually get that feedback, in terms of how present service users are finding the service. So that's obviously been a really good feedback loop in terms of how we develop and improve for the future. But yeah, working with Healthwatch, we've had that local voice coming in, we've tested out ideas as well with the user groups. And I think, it's been really positive to be able to have that honest, discussion.
Brilliant, thank you. And why do you think it's important to come along to community network meetings like today?
You can see, for me as a commissioner, it gives me the opportunity to both speak and hear back firsthand from the local groups and the users that they represent. The range of information and questions that we're given when we come to the sessions are really good. They challenge us in our thinking. It helps us to shape our ideas in terms of what we take away from the session as well. And I think we get the opportunity both to explain our issues in terms of how we both develop services as commissioners and how our colleagues in the clinical services deliver those services, but also get that feedback as well and that critical challenge in terms of what we need to do to improve the service. So they're always a really good session, and I think one that, we need to do more of, to be honest, on a lot of our services.
As part of our trust strategy, we're striving to provide perfect care to the populations that we serve. This includes getting the basics right the first time for our patients. We can only do this if we listen to the people who are using our services, and by working with Healthwatch Sefton, we have the opportunity to listen to those voices and hear what's being said and the experiences of the patients who are accessing services.
I certainly will. My name's Barbara Rouse and I run voluntary Bootle YMCA.
And as a community champion network member, what do these themed meetings mean to you?
They educate me, basically, because a lot of the people that come, I don't know how they work really. You know a little bit from our Healthwatch meetings, and you hear words like podiatry, but you don't really, it's feet, but you don't know how far those people go. And when we have a speaker, they go in depth and they tell us exactly, and I always make notes, and it's very interesting and very educating.
Yeah. So you're able then to pass that information on to the members?
Absolutely. I always make notes, so just in case somebody asks me, or it might just be a conversation that I overhear, or I can give them a bit of guidance and, you know, tell them what I know.